To talk to you now about pediatric growth. So, as I'm sure you are all aware, infant, child, and adolescent growth is really essential. So, when you are a family nurse practitioner and you are seeing children, it's important for you to understand the differences in approaching growth in a child, infant, and adolescent versus approaching growth in your adult counterpart patients. When you see an adult patient, you'll measure weight and you'll measure height and you'll look at their body mass index, etc., which is all done at a well check, just the way you would with a child. But with children, it's different because their growth rates are constantly moving, and their growth rate is very important when considering other concomitant diagnoses. So when you look at children who have other disorders and diseases, a lot of times a growth problem is one of the things that you will see in children. So it's important for you to monitor growth on growth charts and at each subsequent visit of a pediatric patient, because you need to know if they're staying on their own growth chart, if they're falling off of the growth chart, or if they're exceeding areas of the growth chart that would be concerning. So to get started, let's take a look at some of the things that you would expect to see in infancy and childhood. All right, so let's consider infancy to toddlerhood. When you are assessing and managing well care of an infant and early toddlerhood, the things that you will be measuring of importance are going to be weight, length, and head circumference. So why do you think it would be important to understand how a child is measuring in length, weight, and head circumference? Well, infants have an important component in head circumference that we wouldn't necessarily measure as children get older. The reason is from 0 to 2 years old, it's very important to see how well a child's brain is growing. And the way that we assess that in one way through growth is through head circumference. So if you have a child who has a very small head circumference, you might be considering that the child has microcephaly or has congenital microcephaly because of family. And in the same instance, if a child has a very large head, then you may be considering something like hydrocephalus or tumor growth, or again, congenital macrocephaly, which is actually more common in families. One of the things that you would look at with regard to a child's head is, are they staying on their own growth chart? Okay, so what you would be more concerned about is if here we're in the 10th percentile, here we were in the 40th percentile, here we went to the 90th percentile, and here we're well above the 99th percentile and off the growth chart in only 1 year. So that's different from a child who is, say, around 6 months and at the 80th percentile, 85th percentile, 88th percentile, 95th percentile for head circumference, where they're still kind of staying on their own curve. If a kid always has a large head from infancy to toddlerhood and they're otherwise developmentally appropriate and growing well, then it's probably okay. All right, as opposed to if a child has a rapidly increasing head circumference growth, that is not okay. It would be the same instance if a child has a rapidly decreasing head circumference, okay? In the same instance, weight and height from 0 to 2 years old are really assessed very closely. Height is something that's kind of finicky, especially around the age of 6 to 10 months. As kids get more and more active, their weight and their height tend to kind of slow down just a little bit on the growth chart. That's not uncommon. But we do not want to see, just in the same instance where we don't want to see a head circumference go too far up or too far down, what we don't want to see is a child's weight do either one of those as well. If this is a 6-month-old and the weight for this child is in around the 25th percentile, and then at 9 months we see it in the 16th percentile, and then at 1 year old we see it in the 6th percentile, that would be a child that we would start to really get concerned about getting adequate calories from carbohydrates and protein, and we would consider, why is this child getting off the growth chart? It isn't necessarily losing weight, okay? Just because a child falls off the growth chart doesn't mean they're losing weight. It just means they're not gaining weight at an appropriate rate, okay? The same instance, if this child were 1 month old, and here we were in the 40th percentile, and then around 2 months we came down to the 10th percentile, and then again around 4 months we're in the second percentile. That happens sometimes as well, especially in babies who are not getting adequate amount of calories from formula or breast milk. So growth is essential to monitor closely in infancy to toddlerhood, because that's when children in infancy and adolescence grow the most. So monitoring their growth at each subsequent well child check is so important. Now, as far as children who are above what you would expect to see in their weight percentiles, this is honestly a little less concerning in infancy and toddlerhood, unless it seems morbid, okay? So sometimes I'll see kids who are breastfed and man, they are in the 95th percentile for weight here, 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 and here. But they're developmentally appropriate. Their height may be a little bit shorter and or normal, in the same percentile, and their head circumferences is in a perfectly normal percentile. I worry a little less about those babies, okay? There is an overweight baby, don't get me wrong, and we don't want to see babies significantly overweight or obese, but we worry less about their BMI until they get to be around the age 2. If you're starting to see a child who's gaining weight at a very, very rapid rate, then you would want to, in infancy, calculate a BMI and consider what might be going on with this child metabolically, okay? If you see a child who's significantly overweight or morbidly obese in infancy, you would think something along the lines of metabolic or some kind of pseudo presentation of something that would be causing an excessive weight gain, or even a cortisol or adrenal issue that would be causing that excessive weight gain. All right, so next, let's talk a little bit about childhood growth. Okay, so we're talking over toddlerhood here now. All right, and anywhere between early childhood to school age, we start to measure BMI at around the age of 2. We still are looking at weight and height very closely. And then, it kind of is no longer length by the time they get over 36 months. We're really looking at height, okay, or stature, and how tall that child is getting. Now, height and weight around after toddlerhood and up to the age of 10 to 12 is really kind of variable. Okay, you should certainly still see a child stay on their own growth curve, and you should see them, persistently gaining weight. But one of the things that I see frequently addressed as a concern that's not is a child who stays on their own growth curve but is relatively small. Okay, now don't get me wrong, we want children to grow. Okay, we want kids to be as tall as they can get. We want kids to weigh as much as they can get. But I will frequently see many unnecessary laboratory tests or ancillary testing, such as bone growth, x-rays, etc., ordered for a child who is in the 10th percentile since they were age 2, and they've stayed that until they were age 6. But then you look at the mom and the dad, and mom and dad are both, smaller in stature and also smaller in frame. That's okay. All right, as long as a child is staying on their own curve, that's what we would want to see. We would be more concerned about a kid who starts out in the 80th percentile and ends up at the 10th percentile over a couple years. That is a concern, because we know that that child had the potential to be a certain height and weight and is falling off of that curve. Okay, so remember, it's okay for a child to be short, okay, and or not be super heavy when they're on their own growth curve. Okay, that's why growth charts are so important to monitor, because we are going to follow individual growth, not growth in comparison to every other child. Now, don't get me wrong, again, growth charts are essential, and we take those into consideration to use as an average approach to child growth. However, we want to make sure that we are monitoring that that child is growing appropriately for them. All right? All right. So next, adolescence. Okay, this is one of the areas that you start to see growth change quite a bit. And one of the biggest reasons you might see growth change in an adolescent female or male is because of puberty. Okay, so as they are growing and they develop more hormones, and they're becoming more social and independent. Things start to change for them physically and mentally. So adolescence is a really difficult time for managing growth in the self, and I'm speaking from the adolescent perspective because there's so many things going on. For instance, females, once they get to a point where they're starting their period, they do have an actually rapid fat distribution. So you might see a girl around this age, and if she's relatively thin, she may take a little bit longer to develop her period because periods usually start when we've got some extra fat on us. So this adolescent here and here, so I'm guessing this one's probably around age 17 and this one's about age 21, there's not a lot of fat on this body. So we may expect to see adolescents, females who have less fat distribution to start their period at a later date. And that's pretty typical, okay? It is more typical right now in our society due to growing hormones in foods and because of the evolution of how we are, that young women are starting their periods a little early, and we're seeing menarche more around the age of 11 to 13. That's pretty typical as well. But if you're seeing a young female who has less body fat distribution, don't be too alarmed, and also make sure that you're comparing that to family history. Now, one of the other things we see a lot in adolescence is just mental changes, okay? So not only are they hitting puberty, getting extra hormones, boys are getting extra testosterone, so they're growing hair in extra places, and their body muscle is starting to build. They're growing in their velocity. They're getting a lot taller. Boys hit puberty later than females, okay? So on average, boys will peak in puberty after a female does, after age 15 to 17. Girls will peak a little earlier, between 13 and 16. And that's just common because, again, of the way that hormones are distributed in younger females and males. But physiologically, adolescents go through a lot also that affects their growth. Young women may want to feel thin, they may want to feel heavier depending on their culture. Do not be surprised if you see very self-conscious young females if they don't weigh enough. Okay, we do not live in a society where everyone wants to be thin. In some cultures, it is more appropriate for girls to be less thin, to have bigger areas of their body that makes them feel more confident. Okay, so make sure you're approaching those things in a healthy way that are culturally appropriate, culturally sensitive, helping them to feel good about themselves, but also encouraging them to be at a healthy weight for their height. And again, in adolescence, what we're looking at is body mass index, height, and weight. And please make sure you understand, a weight percentile has nothing to do with whether a child is overweight, okay? A body mass index is your way to assess obesity and underweight status, all right? This girl might be in the 90th percentile for her weight, which is very unlikely, or the 90th, let's just say she's in the 90th percentile for her height and the 20th percentile for her weight, and her body mass index is in the 12th percent. Well, she's super tall, right? Okay, and so she doesn't weigh a whole lot, but she's super tall. And so her body mass index is probably going to be a little bit less. But if it's not less than the 5th percentile and she is appropriately gaining weight on her own growth curve, then that is okay. Remember, growth is individualized to each child. This is especially true for any kid who has a chronic condition. And there are many growth charts that are specific to children with chronic conditions such as sickle cell disease, Down syndrome, etc. All right, so the last thing I wanted to do with you is just do a quick run through on how to do a measurement on a growth chart. I'm going to take my own child as an example. Elijah was 26 pounds when he was 24 months old. So we're going to get his weight in kilograms because weight is always looked at in kilograms with children. All right, so 26 pounds divided by 2.2 kilograms is equal to 11.8 kilograms. So at 24 months old, he was 11, 2, 4, 6, 8. We're going to come all the way across here around 24 months. Okay, so he was in between the 10 and the 25th percentile. At this age, he was about the 15th percentile for his weight. He was premature, so he still took some time catching up, but he has previously been at that same percentile. His height, 33 inches. 24 months, 33 inches. Let's come all the way over here. And he is in about the 25th percentile or so for his height. That's all for now. If you have any questions for me, feel free to reach out.